السلام عليكم طلابنا الأعزاء، نرحب بكم في بداية العام الدراسي الجديد 2020-2021 ونبدي وياكم أولى محاضرات مادة جراحة الفم والوجه والفكين للمرحلة الخامسة. محاضرتنا الأولى راح تكون بعنوان Benign Cystic Lesions of the Oral Cavity.
First of all, we will talk about definition of a cyst. Cyst is a cavity occurring in either hard or soft tissue with a liquid, semi-liquid, or air content. It's surrounded by a definite connective tissue wall or capsule and usually has an epithelial lining. How we classify a cyst? There are several classifications of cysts, but the simplest one we can say cyst can be classified into congenital cyst and developmental cyst. Developmental cysts include non-dental cysts and cysts of dental origin. For congenital cysts, we have varieties of cysts. The first one is the Thyroglossal Cyst. Thyroglossal cyst is a cyst arise from any portion of the thyroglossal duct. They are therefore in the midline position of the neck at any point between the thyroid isthmus and the base of the tongue. The cyst may be asymptomatic or may cause some symptoms as a result of a pressure on other structures. Swallowing will cause the mass to be moved. Dermoid cyst. Dermoid cysts are relatively uncommon in the oral cavity. These cysts contains of fibrous wall lined with stratified squamous epithelium, which contains hair, sebaceous, and sweaty gland as well as tooth structure. They may occur on the hard and soft palate, on the dorsum of the tongue, or more commonly in the floor of the mouth above or below the genohyoid muscle and usually in the midline. The dermoid cysts are not easily discovered unless they are cause swelling beneath the chin or up into the floor of the mouth. On palpation, these cysts are having a rubber-like sensation. Treatment by a surgical bronchiogenic cyst. These cysts arise from persistence of the second bronchial cleft. They are characteristically located along the anterior border of sternocleidomastoid muscle at any level of the neck. The cysts are lined with ciliated and stratified squamous epithelium and contain a milky or a mucoid fluid. Treatment for those cysts are by complete surgical excisions. The second subdivision of cysts are developmental cysts. Developmental cysts are of two types: non-dental origin cyst and cyst of dental origin. For non-dental cysts, we have the median cyst. Median cyst is a bone cyst that forms in a median fissure of the palate from embryonic remnants. Median cysts are differentiated from incisive canal cysts primarily by their location, since they are usually occur more posteriorly in the palate. The median cyst has a connective tissue sac lined by squamous epithelium. Nasopalatine cysts or incisive canal cysts. Those located in the center of the bone but do not expand inside the bone, nor do they alter significantly the overlying mucosa. These cysts give no clinical symptoms unless they become secondarily infected. Globulomaxillary cysts. Globulomaxillary cysts are epithelial lines sac formed at the junction of the globular and maxillary processes between the lateral incisor and canine teeth, upper lateral incisor and upper canine. They usually cause a divergence of root of these teeth and appear as a beer-shaped radiolucencies on an X-ray film. As is true with other cysts of the oral cavity, they become secondarily infected and undergo acute inflammatory changes. Treatment by surgical excision. Mucocele results from obstruction of a glandular duct or a minor salivary gland duct and are commonly seen in the lip, cheek, and the floor of the mouth. They may also be found on the anterior portion of the tongue, where the glands are located at its inferior surface. These are small oval or round, translucent, swelling, sometimes having a bluish color. The mucocele is freely movable and usually found right underneath the mucosa. The preferred treatment for mucocele is a complete surgical excision. If the mucocele is incompletely removed, it has a marked tendency to recur, but the lesion is not known to become a malignant. Ranula. A ranula is a cyst forming in the floor of the mouth, generally from sublingual gland. The ranula forms in a manner similar to that of a mucocele, but develop to much larger size. The mucosa is thin out and the cyst assume a bluish color. It is non-painful lesion, but the tongue may be raised and its motion obscured, thus impairing mastication and speech. The ranula is subjected to rupture when injured, with escape of a mucoid fluid that can be reaccumulates as the area heals. The best treatment for a ranula is surgery in form of Marsupialization. Odontogenic cyst. The first of odontogenic cysts is the periodontal cyst. Periodontal cyst is formed from epithelial rests or remnants in the periodontal membrane. These cysts are all of inflammatory origin. The usual location of these cysts are the lateral surface of the tooth, and in this condition the cyst is known as lateral cyst, lateral periodontal cyst, or it may occur at the apex of the tooth, and here it's termed as radicular cyst. When the cysts of inflammatory origin is found in a dentulous area, they are known as a residual cyst. Residual cysts occur as a result of incomplete surgical removal of pathological tissue at the time an infected tooth is extracted. The small periodontal cyst can often be inculated through the alveolar socket after removal of the involved tooth. It's frequently much better to elevate a surgical flap and remove the cyst by the labial or buccal approach, while a large periodontal cysts are treated either by inoculation or marsupialization. Promodial cyst. It's developed when the restoration of the stellate reticulum in the enamel organ takes place before any calcified tooth structure is formed. The word promodial means most simple and most undeveloped in character. These cysts, may lined by stratified squamous epithelium, may be either locular or multilocular cysts. Dentigerous cysts. These cysts develop after the deposition of enamel and are probable result of degenerative changes in the reduced enamel forming epithelium. A dentigerous cyst usually contains a crown of unerupted tooth or dental anomaly such as odontoma. Enlarged dentigerous cyst can cause a marked displacement of a tooth. In addition to that, pressure of accumulated fluid usually displaces the tooth in an apical direction. Dentigerous cysts may be found anywhere in the mandible or in the maxilla, but are more frequently located at the angle of the jaw, cuspid region, and third molars area. Treatment of dentigerous cysts by complete surgical inoculation. Keratocysts. Many follicular and dentigerous cysts contain keratinizing material and are known as a keratocyst. These cysts differ from other odontogenic cysts in their microscopic appearance and clinical behavior. Keratocyst increases in size principally by the process of epithelial cell multiplication and have a greater tendency toward recurrence. What are the clinical presentation of oral cysts? We have many clinical presentation which may indicate that there is a cyst. First of all, swelling in the oral cavity, displacement of the teeth and altered end occlusion as a result of expanding of the cyst, missing teeth, Loosened teeth, they are highly mobile. Non-vital teeth, ill-fitting denture for patients using dentures. Pain and tenderness at the area of the swelling. Pathological fracture due to increase the size of the cyst and effect on the bone. Facial asymmetry due to the swelling, and mental nerve paresthesia due to swelling and effect on the mental nerve. Pre-operative assessment. Before any surgical procedure, we should take the dental history of the patient, careful dental history about his chief complaint, history of present illness, and past dental history. Medical history should be taken also if the patient has previous hospitalization, if he had any systemic disease, if he had any drug use for any systemic disease. Later on, we switch on clinical examination, which include extraoral examination and intraoral examination. For both of them, we should inspect and then palpate the lesion carefully, and then we send the patient for radiographical examination. Radiographs could be either intraoral radiograph as a periapical X-ray or occlusal X-ray, or sometimes we may need extraoral radiographs for better diagnosis and management. Other investigation could be used, which is aspiration from the lesion itself, from the area of swelling, to see the content of this swelling, because the swellings can either contain air or solid swelling, or contain fluid, or contain blood. So from this aspiration, we can differentiate it of any lesion from other, and this can help in our diagnosis and our treatment plan. Methods of treatment of a cyst. We have two basic methods for treatment of a cyst: inoculation and marsupialization. What is inoculation? Inoculation is a process by which the total removal of the cyst lesion is achieved. It's suitable or indicated in all small or moderate size cysts, and even in majority of large size cysts. In addition to that, inoculation also indicated in developmental dental cysts. The technique of inoculation. First of all, three-sided flap should be raised at the area of swelling, and then by the use of bare or bone cutter, the bone should be removed from the area to have access to the cyst. Then the lining of the cyst should be separately carefully from the bone, and the cyst completely removed from the bone. Later on, the bone examined for any irregularity, for any part of the cyst is left behind, because it may lead to recurrence of the cyst. Later on, we should clean the cyst and careful irrigation of the cyst by normal saline, closure of the incision by suturing, and prescription for the patient instruction after the surgical operation.
هذا الفيديو راح يشوفنا الطريقة العملية ل يعني الانكوليشن of a cyst in oral cavity. مثل ما نشوف بالسلايد. First of all, we are going to raise three-sided flap. ورا ما سوينا three-sided flap بالاريا of السيست. نشوف البيشنت عنده fractured retained root should be removed before removing the cyst. فراح يشيل retained root. ورا ما شلنا retained root راح نشوف السيست موجود بالبون of the mandible. مثل ما نشوف ده يسوي extraction للريتيند روت الموجودة حتى نقدر نوصل إلى السيست ونقدر نشيل السيست completely without rupturing السيست itself. فهذا واحد من الريتيند روت، وأكو توث ثاني يحتاج أن نشيله، راح ينشال أيضا. وبعدين نشوف هذا السيست الموجود carefully. راح نحاول أن نسوي يعني نفصل السيست عن البون of the mandible carefully حتى لا يصير عندنا rupture بالسيست، يعني حتى لا ينفتح السيست وتضيع علينا السيست. نحاول أن نشيله as a one piece completely. ف carefully we are inoculating the cyst بحيث نشيله على شكل قطعة كاملة. بتشوفون شلون نحاول أن نسحبه كاملا من البون. نحاول أن نشيله كاملا من البون، وراح نشوف انه الاريا اللي صارت بالبون انه هي صار فد ديفكت بالبون. نحاول ان نرجع الفلاب الى مكانه. ورا ما شلنا تأكدنا انه السيست كله انشال، راح نسوي irrigation. we inspect the area for any irregularity for any piece of hard or soft tissue. وراها راح نبدي نسوي switching. فمن خلال هذا الفيديو نفتهم انه الانوكيوليشن as a treatment of a cyst هي الكومبليت removal of a cyst، يعني نشيله للسيست كله كاملا ما نبقي اي شيء بالبون.
Advantages of inoculation. We have several advantages for this surgical procedure. First of all, the cavity usually heals without little complication and little aftercare is necessary. Second, the complete lining is available for histological examination. While we have some disadvantages for this surgical procedure, those include: first, the clot filling the cavity may become infected. Second, incomplete removal of the lining may lead to recurrence. 3, serious hemorrhage after operation, either primary or secondary hemorrhage. And fourth, damage to the apices of the vital teeth adjacent to the area of the cyst during curettage. The second surgical operation is known as marsupialization. What is marsupialization? Marsupialization is an operation by which the cyst is uncovered or de-roofed and the cystic lining made continuous within the oral cavity or surrounding structure, like the surrounding periosteum, and held in place with a dressing. Marsupialization is indicated in conditions where the adjacent vital structure could be affected, as teeth, as paranasal sinuses, or in cases where a marked bone defect should be avoided. Technique of marsupialization. First of all, a standard mucoperiosteal flap is raised after giving a local anesthesia. Second, the soft tissue is elevated, exposing the cyst. After exposing the cyst, an incision like a cross is then made in the cavity lining of the cyst, and the 4 triangular flaps are turned outward and switched to the surrounding soft tissue. Horizontal matrices switcher being used to switcher the flaps. The cavity is packed with gauze, and then the pack should be changed. This pack should be changed at a weekly intervals.
هذا الفيديو يوضح لنا التريتمنت بلان المارسوبيلايزيشن. مثل ما قلنا المارسوبيلايزيشن هو مجرد دي-روفينج of the cyst. دي-روفينج يعني كأنما نشيل السقف مال السيست. لنتخيل انه السيست عبارة عن غرفة، احنا راح نشيل السقف مالتها. اللي يشتغل هنا السيرجن راح يستعمل الليزر rather than a knife for excising the roof of this ranula. راح يستعمل الليزر مثل ما تشوفون بدلا من السكالبل حتى نشيل الروف مال هذه الرانيولا الموجودة بالفلور اوف ذا ماوث. كل اللي راح يسويه انه يشيل هذا السقف مال الرانيولا، وبعدين يفرغ الرانيولا من الكونتنت مالتها، ويسحبها بالسكر، وبعدين نسوي سويتشرينج للبوردر مال رانيولا within the surrounding mucosa. فراح تبقى الرانيولا مفتوحة، وبهالحالة راح يصير الهيلينج باي سكندري انتنشن، تبدي شوية شوية تصغر هذه الفتحة ان سايز، ويصير هيلينج باي سكندري انتنشن.
What's the advantages of Marsupialization? Marsupialization has one most important advantage, that it is a simple technical process, while has some disadvantages, like first of all, the orifice of the lesion could be closed and the cyst reformed. Second, the epithelial lining of the cyst may be incomplete and cannot be sutured to the margin of the opening. Third, the patient has to have good oral hygiene after the operation, and for several visits are necessary to assess the operation and to have the pack to be changed.
وبهذا وصلنا لنهاية محاضرتنا لهذا اليوم. Thank you for your listening. اللي عنده أي سؤال يقدر يسألنا على الكلاس روم أو دايركتلي بالعيادات، احنا موجودين، أو أثناء عرض اللايف اللي راح يكون محاضرتنا يوم الأحد من كل أسبوع الساعة 10:30 صباحا.